just gotta find a way for them to after.
Ready? Good morning, radio listeners, and welcome to Shedding Light, our weekly program brought to you by the public entity of St. Eustatius. In this week's edition of Shedding Light, we will be talking about an agreement that was signed recently between the island government, Golden Rock Pharmacy, and the Station Waste Solution for the disposal of medical waste. Here to tell us about this MOU are Carol Jack Roseberg, Director of Social Affairs, Jeffrey Lewis, Managing Director of Station Waste Solution, and Yvette Nusser, pharmacist at the Golden Rock Pharmacy. I am your host, Najeska Jack. Ladies and gentlemen, welcome to Shedding Light. Ms. Roseberg, please explain to our radio listeners what this MOU is all about and why is it so important for St. Eustatius.
First of all, good morning, radio listeners, and thank you for tuning in to this week's program. Because what we have in store for you, we feel it is something that is very important. Before I go into what the MOU is about, I will probably ask our pharmacist to give a short introduction about how this all came about, because the idea of the safe disposal of medical waste really came from the pharmacist. So if she could just explain briefly what motivated her to come up with this suggestion, then I will take it over after that.
Okay, thank you, Carol. And thank you everyone for tuning in. Since I started working at the Golden Rock Pharmacy, I had people ask where they would have to take their medical waste. So let's say tablets that expired or they stopped using. And I couldn't really answer it. Then I looked around to instances where people would accept this medical waste, and I realized that there was nothing really in place for it yet. So people didn't really know what to do with it. So some people flushed it through the toilet, or they disposed it with their normal waste, or they just kept it in their medication cabinet at home. So then I approached the health department, and we had several meetings, and also with the Waste Solutions, and we came to this agreement that we will talk about more today.
Okay, so that was the short introduction, and as Yvette, if you don't mind, I will call you address you by your first name. Mm-hmm. And as Yvette said, so when we are talking about medical waste, and medical waste is something really broad, but it has to do with waste that is collected at all healthcare facilities. But in this MOU, we are not going to focus on all of the waste. We are going to try to keep it to medications, expired medications, medications that are unused, like Yvette said, whether the doctor has probably changed your prescription, so you're not using that medication anymore, but you have it at home and not using it. And also, we're going to be addressing the persons that are diabetics and who are, for example, using insulin. You know, so they use their syringes, they have their tester strips where they can test their blood sugar. So this agreement is going to mainly focus on those areas. For other types of medical waste, there are arrangements with the St. Eustatius Waste Solutions and the medical institutions. So we will not be addressing that area in our program today.
Okay, because that was my following question. Okay, can you also explain to the general public what falls under the medical waste?
As I said, it is something that is very broad. It has to do with maybe some soiled bandages that is used at the hospital. It can also include blood material, but we won't really deal with that here on the island. Like I said, it is medication that is expired, or maybe it is unused medication. It can be also syringes. So it is something that is very broad, but we are going to try to focus on what we can handle on St. Eustatius. But medical waste can be very, very broad.
And Mrs. Jack, what is the role of the Public Health Department in a medical waste disposal from the public?
Well, what we are intended to focus on with this MOU is that the Public Health Department signs off. I wouldn't want to say approve, but we sign off on all the medication and the other items then that will be collected for medical waste. So what happens in that sense is that the pharmacist will explain later how that will be done, but then a list comes to the Public Health Department. Dr. Schrubber is the one that is assigned to sign off on that list, and once that is done, it will be delivered to the Waste Solutions, because they will not accept any medication or any medical waste that has not been signed off by the Public Health Department. Besides that, the Public Health Department will also be responsible for distributing sharp containers via the pharmacy to all those patients that are using, for example, insulin, as I mentioned before. And should there be any additional cost, because that we don't know as yet, for the incineration of the medical waste, that is something that will also fall to the responsibility of the Public Health Department. And lastly, but I think which is something very important, the Public Health Department will communicate to the general public how they should collect their waste as well. So that, in short, is the role of the Public Health Department.
Thank you, Mrs. Jack. Ms. Nutter, what is the role of the Golden Rock Pharmacy in the medical waste from the public?
Well, the Golden Rock Pharmacy offered to be a collecting point. Since it's a logical place, because that's where you pick up most of your medication, it's also a logical place to bring it back if you're not using it anymore or when it expired. We will also be the ones handing out the sharp containers where you can dispose your needles, syringes, and all of your tester strips if you're diabetic. That kind of things that are biologically contaminated because they came in contact with your blood or with your skin, and when it's a needle, they go into the sharp containers. In the pharmacy, we will collect it, and we will separate it, because the Public Health Department and the Waste Solutions, they notified us that it's important that liquids and solids are separated for good incineration. So that is the role of the pharmacy.
Yes, and can you also explain what happens to the medical waste that is still within the deadline for use, meaning that it is not yet expired?
This is a very good question. A lot of people ask me this because people feel like medication that is not expired could be used again. But unfortunately, that is not the case, because in the pharmacy, we take really good care of the conditions in which we store the medication, and we don't know what happens when people take it home. And since we don't want to take any risk with the health of our patients, we can't take them back to use them again.
Okay.
So they also will be incinerated.
Okay, thank you. Mr. Lewis, welcome.
Thank you. Good morning.
Good morning. Can you explain what the role is of St. Eustatius Waste Solution in the disposal of the medical waste?
Well, since we were operational for the public, we were working very closely with the health department on how to go about medical waste. As Mrs. Jack mentioned, it's a very broad field, and we have been incinerating medical waste for the auxiliary home and for the hospital, also for certain vessels, if they put in a request to have that come to shore. And then Yvette came up with, what do we do with the medical waste that is actually at home? And then is when the discussion came, well, how can we track that? How can we cater for that? And that's why the MAU came into place. Based on that, the GGD, they actually are the ones who track. And when I say track, they sign off on all medical waste before we receive it at the waste plant. That's part of the process that we have implemented, and that's to make sure that it goes according to the procedure, that we know that things are going how we want it to go.
Okay, and can you also explain to the general public, can the collected medical waste be safely burned?
Yes, it can, because this incinerator is actually a medical waste incinerator, and we burn between 1200 to 1300 degrees. So yeah, we actually, let's say all bacteria stuff like that is properly burned and neutralized actually. Why we burn in three different phases is because the liquid medicine, expired medicine, some have glass containers that comes in bottles, and what we do is we empty them on cardboard so cardboard could absorb it, because we can't really incinerate glass, and that is to make sure that that process goes smoothly. Now, the sharp containers, we don't open them because they are biologically contaminated, so they just burn on their own. And when we have tablets and creams, they burn separately also.
Okay. And is there someone specifically assigned to handle the incineration of the medical waste?
Yes, I made the incinerator a kind of separate internal department. So the person that operates it, they have very, very much good control and insight how to mix the waste and also to set the temperatures correctly. So it's not an open position that anyone can actually deal with.
Okay.
It's one specific person that does it.
Okay, thank you. Mrs. Jack, is there a period when the public health will evaluate the process to make sure that everything is going per the agreement?
Well, what we have just decided is that within the next 3 months, we will evaluate the process just to see how it is going and if there is need to make adjustment. The entire idea is not to stop with this, what we are doing, but to improve on areas where there may be improvement that is needed. So yes, within 3 months, we will evaluate and make adjustments as necessary.
Besides the Shedding Light interview, with the public awareness, with the public department aware to the public and businesses to understand the process for getting rid of this medical in a safe manner?
Yes, we will. Besides this program, I think that it will be a good idea if this program can be repeated. But from the public health department, what we have decided to do is to make brochures, and so we can hand that out to persons. We're going to try to keep it very simple, that it is understandable to everyone. But should anyone have any questions or maybe something is not clear, of course, you can always contact us at the public health department. I am sure that Yvette and Mr. Lewis will be available to answer any questions as well.
Okay, and Mr. Lewis, do you have any final comments you would like to enlighten the general public?
Well, I would just add to Mrs. Jack that we should give this process a good chance, because it's necessary, it's needed. It's an aspect that was not, I would say, managed before. So I would not like for the public to treat it as an option, that they have alternative. It is the way to go about with medical waste, so please drop it off so we can process it accordingly.
Okay, and Yvette, any final comments?
Well, I would like to encourage everyone to clean out their medication cabinets and bring their medical waste back to the pharmacy. But make sure that when you have any biologically contaminated or any sharps, to pick up a sharps container first, so that you can bring it to the pharmacy in a safe way, so that it's also safe for the people who work in the pharmacy to handle that waste.
And Mrs. Jack, do you have any comments?
Just to build on what Yvette said, in the beginning we had already mentioned that the sharp containers will be available by the pharmacy. So that what we have to do from our side then is make it known to the public when they can pick up the sharp containers, because of course the first sharp container that you will receive, you will have to have that filled before you can get a second one. So together with the pharmacy, we will make an agreement as to when persons can pick up their sharp containers. And what I would also like to reiterate is what Mr. Lewis said, is that this process that we are going through is one that is necessary, and that we are looking forward to the cooperation of the entire public in helping us ensure that we safely dispose of this type of medical waste, and that we do not contaminate our environment, because just flushing your tablets or whatever, it seems as though it is something simple, but it can have long-lasting effects. Yeah.
Okay, and thank you. Jeffrey, Yvette, and Mrs. Jack, it was a pleasure having three of you all here on Shedding Light radio program. Listeners, we do hope this information has been useful to you. We will be back on this issue on another Shedding Light edition, and we also encourage you to follow the information shared by the Public Health Department on disposal of medical waste. Thank you for listening, and I am your host, Najeska Jack.